Okay, welcome to lecture 1 of abdominal trauma. This will be part of a series of 2 lectures. We'll start off with a quick overview of what we're going to cover in the 2 lectures. We'll look at basic abdominal anatomy, we'll look at blunt penetrating injuries, and then we'll go into possible intra-abdominal injuries. Okay, so abdominal trauma is difficult to evaluate because a lot of the times the injury is what's a blunt trauma in nature type injury. So you have to gather important information from your scene. So you need to note the circumstances of the surrounding injuries. You need to do an accurate and a rapid assessment of the scene, and this is usually going to tip you off to the possibility of an abdominal trauma. So this is where your windscreen survey and your mechanism of injury become important. Okay. So it's a major cause of preventable death and must be recognized and treated immediately, and usually that requires transportation and getting your patients to a surgeon. Obviously this type of injury is going to be occult, it's going to involve bleeding, and usually you'll need a surgeon to get stuck in there and sort the bleeding and the injuries out. So early recognition and treatment can prevent deaths. Hemorrhage is all important in these types of injuries, so you need to look for early signs of shock in all abdominal injured patients. And then secondary to that, infection, which usually presents a lot later, so it could present hours, days, or sometimes even weeks later. It's also deadly, and there's a lot that we can do in the event of infiltration of the abdominal wall. We can definitely affect that by making sure that we practice a sterile technique when we're treating these patients. I'm just trying to keep our working environment sterile when we're dealing with patients that have exposed viscera or exposed bowels. Okay. So we're going to have a look real quick at the anatomy of the abdomen. We'll look first at the thoracic abdomen. When we talk about the thoracic abdomen, we're talking about the abdominal contents that are surrounded by the thorax or surrounded by ribs. And the ribs provide a certain amount of protection to these organs. Okay, so in this area you'll find the diaphragm, which is really more part of the thoracic anatomy. You'll find the spleen, a very vascular organ that can bleed a lot. You'll find the liver, again a very, very vascular organ and a solid organ that can bleed a lot. And damage to the liver is often fatal. You'll have the pancreas, and then you'll have the kidneys. Okay? So the kidneys do appear in this diagrammatic representation of the abdomen or of the thoracic abdomen, but it's worth noting that the kidneys are also part of the retroperitoneal abdomen, which means that they're not surrounded by that the fibrous peritoneum. Okay. Next, we'll have a look at the true abdomen. So this is where you're going to find a lot of the hollow organs of the abdomen. So mainly your intestine. So you have your duodenum, you have the small intestine, the large intestine, and then the bladder, all of which are hollow organs, all of which are susceptible to rupture, and then which will cause infiltration of abdominal contents, or which will cause infiltration of the contents of those abdominal organs into the peritoneal sac, which will then cause quite a bit of infection, and this is where we have to worry about infection rates for these patients. All right, and then finally the retroperitoneal abdomen, which, as you can see, contains the 2 kidneys, right? Contains the aorta, contains the inferior vena cava, right? And these are major vessels, and they're really important. So these vessels will bleed a hell of a lot, right, if they are damaged or ruptured. Okay? And then obviously we have the spine in that retroperitoneal area. All right. So the spine obviously extends through the abdominal area into the thoracic area, all the way up to the base of the skull. All right. So this is not the only place where you can find the spine. So anatomy 101 there. Alright, fantastic. Moving on, so we're going to talk first about the thoracic region. So often life-threatening hemorrhage, as I spoke about previously, both the liver and the spleen, very vascular organs. The liver has a very large vessel that runs directly through it. It also contains a large proportion of the body's blood at any one time. So if you get an injury to the liver, that can bleed a lot. Likewise for the spleen, very vascular, doesn't contain quite as much blood as the liver, but this is a splenic injury is one that will sneak up on you in the trauma environment. There are ways to identify that, and we'll discuss it a little bit later with referred pain, but a splenic injury will bite you in the backside if you're not ready for it. We have the true abdomen. So the true abdomen, this is where we spoke about all those hollow organs. Okay, so we have a definite risk of infection, right, because of the infiltration of the contents of those hollow organs into the peritoneum. Okay, so you'll get peritonitis as a result of that. Shock, so the intestines can bleed quite a lot. Okay, so you need to be aware of signs of shock with these patients. Often you'll be able to identify if you have bleeding intestines, and we'll chat about that a little bit later in the next lecture. In the retroperitoneal abdomen, again, severe hemorrhage. We spoke about those major vessels. So you've got the aorta and you've got the inferior vena cava, and then you've also got the kidneys, which are both solid organs, very vascular. If they do get necked, cut, or split, they do tend to bleed a lot. Okay, so this is just some statistics about the most common causes of mortality with abdominal trauma. So with blunt trauma, the chances of your patient dying as a result of blunt trauma is 10 to 30%. With penetrating trauma, gunshot wounds, 5 to 15%. That's a pretty high percentage. A lot of gunshot wounds cause quite a lot of damage, and I'm sure you will discuss that when you talk about ballistics. And then stabbings, mortality is 1 to 2%. So that's a pretty small mortality rating for stabbings. But please take note that that's only for the abdominal region. We're not talking about thoracic stab wounds, which have a much higher rate of mortality. So intra-abdominal bleed with hemorrhagic shock and sepsis or peritonitis are going to be our major concerns with blunt and penetrating trauma in the abdomen.